Hi, my name is Thuanvuudpt. I'm a physical therapist, and I have a new theory on how to properly stretch muscles. One of the things that I've noticed and that a lot of my patients have commented on is the fact that most therapists stretch patients within their resting place. They try their best to get them back into neutral, but they don't actually stretch into the neutral plane. That's one of the main areas that I think we need to change. So my new thought is directionally based stretching, or DBS. The whole key to DBS, there's two different functions to it. First is we have to look at the rotation and how we're stretching to maximize the stretch itself. And the second part of it is actually looking at the skin. What we fail to do is we look at the muscle and we look at the joints and the bones and how they're aligned, but we don't necessarily stretch specifically the skin in and of itself. So those are the two main areas that we need to address. The first one being rotation. We all naturally rest within a rotation. Either we rest with our arms outward or we rest with our arms inward, but either way, one way or the other, we're resting in a direction. More often than not, what we do is we rest with our arms internally rotated inward, our chest tight, our head neck forward, and our head and neck back. So that way we actually hold this posture more often than not. I call it society's technological posture, more or less. But what we want to do is when we're stretching that way, when we're sitting this way and we're trying to stretch up, as you can see, there's that internal rotation within the arm, and therefore it's biasing the chest muscles and only stretching some of them. So what we actually need to do is look at more of the direction that we need to stretch. It's not just an elongation of the muscle. We actually have to physically release the adhesions that are between the muscle and the bone and the muscle and the skin, because that's where the key is. So we actually want to take the skin and actually rotate it back into neutral and then provide the stretch. And that way we're actually getting a more deliberate stretch for the patient themselves. Everyone's individually based, so you have to look at the patient and how they're functioning to do the stretch. If they're externally rotated, you want to bring the arms inward. If you're internally rotated, you want to bring the arms outward. And that brings me to the second point. It's not only that you're looking at the joint positioning and the muscle balance, you have to look at the skin. The skin in and of itself is the most important aspect of it, because when we have that rotation, the skin actually binds down to the different condyles and different bony prominences and creates some of the long-term impingements. I see it a lot in my patient population just because a lot of my patients are in wheelchairs. So they sit a lot and they don't necessarily use their arms and legs the way they need to. So you see them severely contractured, there's always a rotation to it, and there's always adhesions all over the place. And so it doesn't allow them to have the free movement. If you simply free up the skin from the muscle and the muscle from the bone, you literally get a better force production. They can use the muscle, they can use the anatomical positioning that they're in if they can actually use the muscle, if they can access the muscle. And the only way they can access the muscle is by freeing up the skin. The way I kind of say it is there's supposed to be a 50-50 balance between the muscle and the skin. But normally, with any type of contracture, there's a 70-30 pull, 80-20 pull. And so there's not the proper force production. One side is always tighter than the other one's elongated and stretched. It's just how it happens. The only way to truly get a good force production again is to release the 70 and 80 and pull it back over into the main area. So actually getting that 50-50 balance again. Check out the video. If you guys have any questions, you can hit me up at Thuanvuudpt@gmail.com. It's THUAN, N as in Nancy, V as in Victor, UU, DPT, Doctorate of Physical Therapy @gmail.com. If you have any questions, I hope you guys will hit me up because I want to know what your thoughts are, and I hope to help with all of you guys in the therapy realm and with anyone who needs stretching. So feel free. I am Thuanvuudpt again with my friend Stephanie. We're here to talk about the rotational aspects of stretching itself. This time we're going to be doing the knee. What we're looking at is contractures within our hamstrings. We're looking at tightness in the quad, tightness in the gastroc soleus complex. You can feel it in the adductors and the IT band. She has a post-surgical scar of her hamstrings released on the inner medial side. You can see there's decreased rotation internally, as well as externally is better than internal. You can see the tightness within the hamstrings, within the calves, and the limitation it has within her knee extension. So what we're going to work on is not just stretching of it through the elongation aspect of it, but we're going to do some internal, external rotation depending on the positioning of the leg. When Stephanie first began, she internally rotated and then externally rotated at the tibia. So what we've been working on is external rotation at the thigh and internal rotation at the tibia fibia. So the whole key behind it is the torque that it has within the physics of the muscle contractions doesn't allow for straight elongation of it. So what we want to do is a little bit more of a rotational aspect of it. Are you playing around, ma'am? Can you get your head up for me? Thank you. Hi. How are you doing? High five. Okay. Ready to stretch out your leg? Yeah? Okay. So what we want to do is a little bit more of a rotational aspect of it. You can see there's a little bit more of a give internally, or external rotation with the tibia. But if you do external rotation here, you can see the limitations just within the quad itself. So if you do a little bit of rotational stretch with it, you can free up the myofascial adhesions. So you can work through the soft tissue of the quad and then get into the adhesion points within the skin itself. And you can see the pucker within the muscles and within the skin. If you free up the skin, you free up the muscles behind it, and you allow for the elongation of it. So literally, if you come into the fascial plane and release the fascia plane, it creates the elongation for you. I'm literally lifting the skin from the hamstrings itself and the IT mat, trying to loosen it all up and trying to break it up from the adhesions within the patella itself and within the plateaus of the femur, or the condyles of the femur is a better way of saying it. See the rotational aspect of it?
Yeah, I remember you said that, yeah.
You can see the elongation. Don't lean back. Make sure you sit up nice and tall for me. Sit up nice and tall for me. You got it. Thank you. Kick on out. Thank you. One more time. Kick on out. Good. Because she externally rotates so much on the leg, you want to go opposite direction with the calf. And she has the adhesions all along the tibia. Sorry, fibula. And as I rotate through, you can see the foot coming into more neutral, the knee coming into more neutral, and when she kicks out, she gets a better knee extension. I say she gained about 15 degrees. And that's all it really is. If you do the rotational aspects within it, you can always achieve more than just straight elongation. If you treat it all as one primary group and break up the group and the fascia around it, and take it in segments, you'll be able to break up more of the adhesions along the muscle belly because it gets stuck in the straight plane of it, in the elongational plane of it. So if you do the rotational aspect of it, it breaks up more of the adhesions along the way. 30 seconds and then we can be done, okay? Thank you, man. Kick out for me. If you do active assist with the rotation of it, it provides a little bit more of a stretch and gets the muscle moving a little bit faster.
Yeah.
Ready? All the way out. Good. All the way out. Good. All the way out. All the way out. Good. Last little bit. Good. Good. You can see the positioning of the patella lowered. You can see the quality of the skin movement improved. Her foot position improved. And as she kicks out, all the way out, her knee extension improved as well. So, rotational aspects is based on the direction to which the contractures sit. If it's internally rotated, you want to rotate outward of it, and vice versa. There can always be an opposite force within the foot and the knee, as well as the arm and the elbow. Just depends on which way they're coming. You want to go to the resting position again. You want to stretch to the opposite direction that they're sitting in. Give it a try. Let me know what you guys think, and hope the directional stretching helps out.